Hello everyone, welcome back to my YouTube channel, The Disease Decoder. Today our topic of discussion is migraine. Migraine is a very common disease nowadays and every next person to you may have symptoms of migraine. Let's uncode migraine. What is migraine? Its types, its factors, pathophysiology and signs and symptoms. Okay, let's start. What is migraine? Migraine is a neurological disorder characterized by recurrent episodes of moderate to severe headaches, often accompanied by other symptoms like nausea, vomiting, sensitivity to light and sound. These headaches are typically pulsating and may affect one side of the head. Migraines can last for hours to days, significantly affecting daily activities. Okay, they are usually one sided, they usually affect one side of the head. Okay, migraines are the neurological disorder characterized by episodes of moderate to severe headaches, accompanied by nausea, vomiting, sensitivity to light or sound, and can last for hours to days and usually affect one side of the head. This is migraine. Our next session is about the types of migraines. There are many types of migraines like migraine with aura, migraine without aura, chronic migraine, hemiplegic migraine, retinal migraine, menstrual migraine, and two others. First, we start with migraine with aura. What is aura? Our main concern here is what is aura? Aura refers to perceptual disturbances experienced by some individual before a seizure or migraine. Aura can manifest in many forms, including visual disturbances like flashing lights or zigzag lines, sensory changes such as tingling or numbness, or other unusual sensations like an odd smell or taste. Okay, for understanding, you may keep in mind that these are perceptual disturbances. Our first type is migraine with aura. It's the most common type, characterized by headache that comes without warning and is usually unilateral and pulsating. Pulsating means it occurs in episodic way. Unilateral and pulsating, and it occurs without any warning. As the name shows, migraine without aura. Our next type is migraine with aura. As we discussed our aura earlier too, this is a classical migraine, involves visual disturbance or other neurological symptoms before the onset of the headache. Okay, neurological symptoms before onset of migraine. These can include flashing lights, blind spots, or tingling sensations. Okay, our third type is chronic migraine. Chronic migraine occurs 15 or more days a month. That's why it is chronic. For more than 3 months, this period can go for 3 months. Then we say it is chronic migraine with at least 8 days featuring migraine symptoms. We discuss migraine symptoms in the next sections. Our next type is hemiplegic migraine. A rare type, hemiplegic migraine, a rare type that includes temporary paralysis or neurological symptoms on one side of the body, often mimicking a stroke. Symptoms like that of stroke. as it includes temporary paralysis or neurological symptoms on one side of the body. Our next type is retinal migraine. Retinal migraine is characterized by temporary vision loss, temporary vision loss or visual disturbances in one eye before or during the headache. Our next type is menstrual migraine linked to hormonal changes during the menstrual cycle and usually occurs around menstruation. Okay. Our next type is vestibular migraine causes dizziness with or without a headache. Headache is not compulsory in vestibular migraine. Our next type is abdominal migraine, more common in children. It involves stomach pain, nausea, vomiting rather than a headache. Not involve headache like vestibular migraine. Let's summarize. We discussed types of migraine with aura. Aura is the perceptual disturbance in someone's mind. Migraine with aura, without aura, chronic migraine, hemiplegic migraine, retinal migraine, menstrual migraine, vestibular migraine, and abdominal migraine. Our next section is about the risk factors of migraine. First risk factor is genetics. A family history of migraine increases the likelihood of developing them. Family history. Our next risk factor is gender. Women are more patients of migraine, particularly during hormonal changes like menstruation, pregnancy, or menopause. Okay, pregnancy, menstruation, and menopause. Age is the next risk factor. Migraine often begins during adolescence and peaks during the 30s. Okay, it's the disease in youngs and it can occur at any age. Next risk factor is stress. Both physical and emotional stress can trigger migraine. Physical and emotional stress can carry them again. Next is factors, dietary factors. Certain foods and beverages such as alcohol, caffeine, and processed foods can trigger migraine. Our next risk factor is sleep patterns. Both lack of sleep and excessive sleep can trigger migraine. Our next risk factor, last risk factor is environmental factors. Bright lights, loud noises, and strong smells can trigger migraine attacks. These are the common risk factors of migraine. Our next risk section is about the pathophysiology. The exact cause of migraine is not fully understood, but it is believed to involve a combination of genetic, environmental, and neurological factors. The pathophysiology includes four major steps. Neuronal first step is neuronal hyperexcitability. Abnormal activation of neurons in the brain, particularly in the trigeminal nerve, leads to the release of neuropeptides that can cause inflammation and dilation of blood vessels. Trigeminal nerve is the fifth cranial nerve of our body that mainly supplies the face region of the body. Our next in that category is cortical spreading depression, a wave of electrical activity spreading across the brain, leading to aura symptoms and activating the trigeminal nerve. The next step here is neurogenic inflammation. Release of inflammatory mediators cause pain and further dilation of blood vessels. Last but not the least, in pathophysiology of migraine is serotonin imbalance. Serotonin is the hormone that usually famous by name of feel good hormone, as it enhances our mood. It controls our appetite and digestion, our sleep patterns, and serotonin imbalance can trigger migraine. Altered serotonin levels affects blood vessels and pain pathways, contributing to migraine symptoms. Okay, this is the common pathophysiology of migraine. Our next section is about the signs and symptoms of migraine. The first sign and symptom is headache, typically unilateral, pulsating, and can last from 4 to 72 hours. Okay, next is aura. As we discussed earlier, visual disturbances like flashing lights, zigzag patterns, or blind spots. Next is nausea and vomiting. Next sign and symptom is sensitivity to light and sound. And next is neck pain. Neck pain sometimes produced by headache. Second last sign and symptom is fatigue and irritability. Fatigue and irritability may occur before or after the migraine attack. Dizziness, particularly in vestibular migraine, as we discussed here. Vestibular migraine can cause dizziness. These are the main signs and symptoms like headache, aura, nausea and vomiting, sensitivity to light and sound, neck pain, fatigue and irritability, and dizziness. Our next section is about the ways of diagnosis of migraine. These are the most common ways for diagnosis of migraine. First way of diagnosis is clinical history. A thought history of the patient's symptoms, including frequency, duration, and associated symptoms, is crucial for the diagnosis of migraine. Next is neurological examination to rule out other causes of headaches and assess for any neurological deficits. Next is imaging studies. Imaging studies like MRI or CT scan may be ordered to exclude other serious conditions like tumors or strokes, especially if the migraine presents atypically. Next is headache diary. Patient may be asked to keep a diary of their headaches to identify triggers and patterns. Blood tests. You may wonder why blood tests in migraine. Blood tests are necessary to rule out infections or other systemic conditions that could mimic migraine symptoms. Okay, that's why blood tests are necessary in migraine patients, because we don't know is it migraine or any other disease. These are the common ways for the diagnosis of migraine. Our last section is about the treatment. First, we start treating the migraine patients with lifestyle modifications. First step in lifestyle modification is stress management. Techniques like medication, yoga, therapy can help reduce stress related triggers. Regular sleep patterns, maintaining consistent sleep schedules. Next is dietary changes, avoiding non dietary triggers like caffeine, alcohol, and certain processed foods can lower the chances of migraine. Our next is our next section is hydration. Stay well hydrated. It's a way for treating migraine. These are the lifestyle modifications. Uh, as in every we discuss about the medications. These are the common medications we use in the treatment of migraines. There are certain medications we discuss each of them in detail. First medication is analgesics. Analgesics also known as pain relievers. I mentioned names of two analgesics here. aspirin, and naproxen. These non-steroidal anti-inflammatory drugs help reduce inflammation and pain during a migraine attack. They are most effective when taken early in the onset of a migraine. I am talking about analgesics. Analgesics relief from mild to moderate pain, reduction in inflammation, and elevation of associated symptoms like nausea. Okay, our next medication is triptan. Sumatriptan is the main medication here. There are many triptan medications other than sumatriptan. Triptans are specifically designed to treat migraine. They work by stimulating serotonin receptors, which cause blood vessels in the brain to constrict and block pain pathways. They affect by reduction in headache pain, relief from nausea and light sensitivity, and a decrease in other migraine symptoms. They are effective for moderate to severe migraine attacks. Our next medication is argotamines. Argotamines are used to treat migraine attacks by constricting blood vessels and reducing inflammation. They are less commonly used due to side effects and are typically prescribed when triptans are not effective. Our next medication is anti-nausea medications. Anti-nausea medications are used to relieve nausea and vomiting associated with migraine. They affect by producing reduction in nausea, vomiting, or other gastrointestinal symptoms related to migraine. Our next medication is CGPR inhibitors, calcitonin gene related peptide inhibitors. These newer medications target and block CGPR receptor, which is involved in the development of migraine pain. Our next medication is beta blockers. Propranolol is the main drug here. They are most commonly used as preservative medications for migraine. They work by reducing the frequency and severity of migraine attacks. They produce effects by lowering blood pressure, reduction in the frequency of migraine attacks, and prevention of migraine onset. Our next medication here is the antidepressants. I mentioned amitriptyline antidepressant medication here. These medications can be used for migraine prevention, particularly when patients also have depression or anxiety. They work by affecting neurotransmitters in the brain. Next most important medication is Botox injections. Botox injections, botulinum toxin, they are approved for chronic migraines. Botox injections help prevent migraine attacks by blocking the release of chemicals involved in pain transmission. They produce effects by reduction in the frequency and severity of migraine, especially in chronic migraine. Next medication here is magnesium supplements. Magnesium oxide can be used as a preventive treatment for migraines, particularly in individuals with magnesium deficiency. Our last medication here is serotonin receptor agonist, a newer class of medication that acts on serotonin receptor without constricting blood vessels, usually for acute treatment. Serotonin receptor agonists are used for acute treatment. They produce effective relief of migraine pain without cardiovascular side effects. This is all about the migraine. Let's summarize. First, we started with the migraine. What is migraine? Migraine is a neurological disorder characterized by episodes of moderate to severe headaches that results in nausea, vomiting, sensitivity to light or sound, and can last for hours to days and is usually one-sided. Then we talked about the types of migraine: migraine with aura, migraine without aura, chronic migraine, hemiplegic migraine, retinal migraine, menstrual migraine, vestibular migraine, and abdominal migraine. Then I talked about the risk factors. First risk factor is genetics, means family history. Gender: women are usually more affected, age in mostly 30s. Stress: physical and emotional stress can trigger migraine. Dietary factors, alcohol and caffeine and processed foods can trigger migraine. Sleep patterns, both lack of sleep and excessive sleep can trigger migraine, and environmental factors can trigger migraine too. Then I talked about the pathophysiology of migraine, sign and symptoms of migraine: headache for 4 to 72 hours, aura, nausea and vomiting, sensitivity to light and sound, neck pain, fatigue and irritability, dizziness. Then I talked about the ways of diagnosis. There are five ways of diagnosis: clinical history, neurological examination, imaging studies like MRI and CT scan, headache diary, and blood tests. Then I talked about the treatment options. There are two treatment ways. First is the lifestyle modifications, and then medications. In lifestyle modification, uh, we manage stress, regular sleep patterns, dietary changes, and hydration. Our next and the last section was about the treatment. The first medication here is the analgesics, then triptans. Triptans are the most commonly used medications for migraine patients. Then arbutamines, anti-nausea medications, beta blockers, antidepressant, botox injections, magnesium supplements, and serotonin receptor agonists. This is all about the migraine. I hope you enjoyed the video. If you enjoyed the video, don't forget to like and share with your friends for the enhancement of clinical skills. Thank you.